Right, okay. Could I have an ambulance, please? Okay, number 8 Broadway called me. My stomach's in agony, Doc. I've got lumps in my stomach. Yeah, I'm in agony, Doc, yeah.
Okay, have you got any other symptoms?
No, Doc. Just sweating a lot. Weak. Feeling weak.
You feeling what?
Weak.
Weak.
Yeah.
Yeah, this is clearly, a British caller and dispatcher. Honestly, it's kind of hard for me to understand what he's saying through both the accent and I'm not sure if maybe he's or has some type of issue where he can't speak clearly, or maybe it's just the audio quality. But if the subtitles weren't there, I wouldn't probably know everything he was saying.
How long has this been going on for?
Mostly all day, Doc. A few hours.
Last few hours?
Yeah.
Okay, put your hand on your tummy or your chest. Tell me if it feels a normal temperature.
Yeah, Doc, yeah.
Yeah, it just feels warm?
Yeah.
Okay, have you had any diarrhea or vomiting?
Stomach's in agony, Doc.
Okay, have you had any diarrhea or vomiting?
Yeah, I've been sick a few times, Doc, yeah.
You had any diarrhea?
No, Doc, no.
You brought up any blood?
No, Doc.
Okay.
Gallstones in my stomach, Doc.
You have?
Yeah.
Okay. Have you got any crushing or severe aching pain in your chest, upper back, or upper abdomen?
The reason she's asking that is we have to ask that question with abdominal pain in case it might be an aortic aneurysm, which is a really severe medical problem. I don't really quite remember what it is. I think it's something to do with your main artery in your chest and it like rupturing or something like that. But with abdominal pain, we have to ask that. We ask it here at my agency in America a little bit differently, but yeah, that's why she asked that.
No, Doc. I've got just pain in the stomach, Doc, yeah.
Is it below your belly button or above your belly button?
Above, Doc.
So have you got any crushing or severe aching pain in your upper abdomen?
Sort of, yeah.
Okay, what do you mean by sort of when you say sort of?
I think so, Doc, yeah.
Right, you say it's a stabbing pain?
Yeah.
Is it a stabbing pain rather than a crushing or severe aching?
More like stabbing pain, Doc, yeah. Could I have an ambulance, Doc?
So every agency, again, does do this a little bit differently. At my agency, we dispatch as soon as we know exactly what's happening and if we know if the patient is conscious and breathing or not. Some agencies will wait until we get what's called the determinant code. So an Alpha, Bravo, Charlie, Delta, Echo response, which is basically just different levels of it's basically determining how severe the situation is. So like an Alpha Bravo response is like a BLS response. So like an EMT response, whereas like a Charlie Delta Echo, that's like a paramedic response. So I would obviously be encouraging this person. Yeah, responders have already been dispatched. So these questions are not delaying them. But as far as the way that she's questioning him with the software that we have, it eliminates leading questions is kind of what she's doing here. So she's saying, you have a stabbing pain, right? So that's kind of considered a leading question. We have to ask it in a very specific yes or no way. But again, I don't know if things are different over there.
Okay, have you passed a bowel motion that looks black and tarry or red or maroon?
No, Doc.
And have you suddenly become confused or more confused than usual?
A little bit, Doc, yeah. You get lightheaded.
Oh, you keep going dizzy and that, yeah?
Yeah.
Now, Mark, from what you told me, right?
Yeah.
You don't require an emergency ambulance, but what we are going to do, we're going to want somebody to call you back, okay? So
yeah.
just confirm.
Can't I have an ambulance?
No, for the answer you give me, you don't need an ambulance, okay?
I'm in agony, Doc.
Okay, I appreciate that, but from the answer you give me, you don't require an ambulance. What you do need to do is be seen by speak to the local GP within the next 2 hours, okay?
So my initial thoughts are, yikes. That sounds like a lawsuit waiting to happen. Yeah, at my agency, anytime someone calls 911 and says there's a medical problem, we are required to send an ambulance, even if they're just saying, oh, I just want advice. I just wanted to like a nurse hotline type thing. So we are required to send an ambulance to anyone who's calling 911 and explaining a medical problem, even if it seems really dumb, even if it's like toe pain or, we have to send someone. So the fact that we're telling him that we're not sending a response when he's describing what sounds like crushing abdominal pain and confusion and dizziness, that's very alarming.
Do I need to go to the hospital? In the hospital?
No, you just need to stay on the phone for a moment, okay?
Yeah.
Paracetamol can help with your tummy pain. Follow the instructions on the pack. Any doubt, ask a pharmacist. Don't use ibuprofen or any anti-inflammatories such as aspirin, as they can make your stomach worse.
Yeah.
Now, stomachache is very common, not often serious, and gets better on its own, but you can try a warm bath, hot water bottle on the painful area, but if you collapse, become unconscious, unresponsive, faint, or become pale, cold, or clammy, it's 999.
Yeah.
Okay.
Yeah, I'm amazed that she's allowed to tell him what medicines to take. At my agency and a lot of centers, we're not allowed to tell callers what medicines to take, with the exception of if it's a possible heart attack, we tell callers to take aspirin, or obviously an allergic reaction, we tell them to take their EpiPen. But yeah, I'm amazed she's able to tell him, yeah, just take some Tylenol, and yeah, that's crazy.
Evans, what can I do for you tonight, please?
I've got pains in my stomach.
Right, okay.
I've been sick a lot.
Right, okay. When did this pain start as such?
About 4 hours ago.
Right, okay. I mean, if you mind me asking, whereabout in your stomach do you have it? Is it in the center, right, left, up, or bottom?
Left and right.
Okay.
Below my rib cage.
Okay, yeah.
Below my belly button.
Therefore, I mean, are there lower abdominal pains then?
Yeah.
Or is it all over your abdomen?
Yeah.
Right, okay.
I've got gallstones, see.
Alright, okay. Alright, okay. You're known to have gallstones.
Yeah.
Right, okay.
I'm in agony, yeah.
Okay.
I'm in agony. Could I have an ambulance?
I mean, if you need an ambulance.
Feels like I'm going to pass out.
Right, okay. If you need an ambulance, you need to directly call 999, you see.
No, you've got some shortness of breath.
Shortness of breath, tightness in his chest, his arms and legs are hurting. He's not slept for 3 days, and he's not had anything to eat for 3 days, and he's had diarrhea.
Okay. Has there been any bleeding? Because I've bled very heavily at all in the last 30 minutes. Any blood loss? Yeah.
No,
so he's got
no bleeding.
Okay, so he's got some difficulty in breathing and some chest tightness and swelling.
Yeah. Swelling in the stomach, a lot of pain in his stomach, all around the stomach, and his arms and legs, he says are in pain.
Okay.
Do you want to speak to him?
If it's possible.
Yeah, I'll pass him over.
Okay.
Hello?
Hello, is this the patient?
That's Doc, yeah. I'm on some breath, Doc.
Yeah, struggling, okay. And you're 41, that's correct.
That's Doc, yeah.
Okay. Did this breathing problem come on suddenly?
About Friday, Doc. Friday, yeah.
Have you got any pains in your chest or your upper back at the moment?
A little bit, Doc, yeah. Yeah.
Right, do you want to put the other person back on the line for me?
Okay, Doc, yeah.
Okay.
Most of the time it's the opposite, where the patient is on the line struggling to talk, and you ask the patient to pass the phone to someone else so they can focus on just being comfortable and breathing. But yeah, he's clearly in agony. He's not going to be able to answer questions very well.
Hello?
Hello. Right, so he's got some pain to the chest as well at the moment.
Yes, he's got pain in his chest.
Okay, what was his name? Mark Evans, was it, or Hemmings?
Mark Hemmings, sorry, Hemmings.
Hemmings.
Yeah.
Okay, and what's your name, please?
My name's Yasser Mohammed. I'm Mark's tenancy support worker. He lives in supported accommodation. He suffers from anxiety and depression.
Extremely unfortunate and very tragic for that man that he called for help and didn't get the help that he had wanted. It's just very sad. Yeah, at my agency, we would send him an ambulance where it's not our call to determine what kind of response he needs. I didn't even realize, like it said in the middle, that it was Easter weekend. So, and clearly, even with his agony, he's not going to be able to drive. So, you know, we wouldn't encourage anyone to be driving regardless if they're having a medical problem. So it's just amazing to me that they were advising him to do that. But very sad. Yeah, could differ from agency to agency. Sometimes you might get like just a fire truck, but you know, we are usually required to at least send someone to you. So yeah, it's very unfortunate this man didn't get the help he needed.